Virginia, and I am here today to give you a demonstration on how to bathe a client. Because we're in Corona, I don't have someone to bathe, so we're going to use this wonderful being. He has offered to be bathed for us. So when you come in to bathe a client, you're going to introduce yourself. Hi, my name is Virginia. And then after that, you're going to go wash your hands. So we're going to wash our hands. You make sure to do it for at least 20 seconds. You make sure to wash between your fingers, under your nails. Lay down. Sit. Sit. Roll over. And then you begin washing your client. So to start with washing your client, you're going to get a bath towel or a bath sheet. You're going to cover your client. Obviously, this isn't going to work in this situation, but we're going to cover our client to maintain privacy and some kind of, this is very hard on dignity with clients because they don't want to be bathed. So they want to do it themselves. We are going to move forward with collecting our supplies. Since I'm at home, I have a bucket, I have soap, we have washcloths, and any other of the bath supplies that your patient might request. For Mr. River, we are going to be using a odor eliminating spray. That is also okay for people. So to start off, we're going to start with the face. Make sure you get your water. You're going to have warm water. The suggested temperature for water is going to be approximately 105 to 110 degrees. This is warm enough that it's not going to burn your client, and also it's not too cold. So to start off, you're going to do a mitt. And how you do that is you place it over your hand, fold it back, and then you fold the sides over your hand like so. And then you have a mitt. So with your client, you're going to ask them if they can wash their own face. They may be able to, they may not. We're going to assume that Mr. River cannot wash his own face. Sit, sit. So with your clients, when you're washing their face, you're going to start with their eyes. You're going to go from the inside out because you don't want to be pushing things into their eye. So we're going to start with going out and sit. Going out, and then with every wipe you're going to get yourself a new corner of your cloth, and we'll just wash your face, and we'll wash the face. Good boy. When you're bathing your client, you're also going to make sure to wash well behind their ears because that is some place where a lot of dead skin collects and it gets dirty. You sweat back there. So we're going to wash behind the ears. Okay. After you've washed behind your ears, sit, lay down, roll over. You're going to begin on the arms. So with your arms, usually you would put your patient's arm in, you're going to put their hand into your bucket of water. With that, that's soaking the hand, that's getting all the dirt and grime out from under their nails. And while they're doing that, you can begin to wash their arms. So we're just going to clean their arms, make sure you have a nice soapy, sudsy cloth. You're going to clean as much as you can. This is a good time. You can either wash their armpits now, or you can wash it when you're washing their chest, but I'm gonna do it now. So we're washing his armpits, we're washing his arms, and we're just letting his hands soak in the water. After you've done that, you're going to get a clean washcloth that has no soap on it. You are going to wash off, you're gonna rinse off all of that soap that you had put on there with your previous cloth. After you've done that and discarded that cloth as well, you're going to get one last dry washcloth or towel, and you're going to just Pat them dry, because with a lot of patients, they have very sensitive skin. So you're not going to want to rub or scrub them dry because you can cause abrasions or skin tears. You don't want to do that. So we're just going to pat dry, and that's going to help your patient out a lot. So after you've done that, again, with the armpit, you can either apply deodorant now or later. I don't think he wants deodorant, so we're not going to put any deodorant on him. Once you're done with the arms, you're going to move to the legs. So it's the same thing. You're going to have your bucket of warm water. At this point, your water may have cooled off some. It's definitely okay for you to take your bucket to the restroom, dump out your water, and get a new more warm water. So we have our new warm water. Lay down. Hey, sit. Lay down. Lay down. Roll over. Roll over. Come on, it's right here. Roll over. I need your belly. We've washed his legs. So after you've washed the legs, you're going to move to the trunk. And as with the arms, dude, stop. You're embarrassing yourself. Lay down. Roll over. Roll over. So after you've washed the legs, you're going to move to the trunk. You're going to wash their stomach. You're going to start with your sudsy cloth. You're going to wash them well. After you've washed them with soap, you're going to rinse it off with your new cloth. Get a new cloth. Rinse it off. After that, you are going to get your towel and you're going to pat them dry. After that, you are going to wash the genitalia. With that, you can ask your client if they're capable of doing it themselves. If they are capable, you will allow them to wash their own genitalia, but in some cases they're not. So you're going to take your rag, you are going to make sure to clean around the meatus. You're going to move in a outward. Do not push grime inside towards the urethra. You're going to move outwards and down for males and front to back for females. So with River, you're going to make sure that you get all of the areas, and then of course, rinse, dry, move on. We haven't done his back yet, so with your patients that need assistance, you're going to help them roll, and that gets the back where you can easily clean it. Start again with a wet soapy cloth. You are going to clean the back, not very rough again because you don't want to cause skin abrasions. After you have washed their back with soap and water, you are going to move on to your soapy cloth, or your soap-free cloth. It's going to be your rinsing cloth. He's getting it off his back himself. So you're going to just rinse it all off, get all of that soap off of their back. After you've done that, you follow up again with your dry cloth. Can I dry your back, sir? Sir, I need to dry your back. And then you're going to dry. Pat dry, as always. We don't want skin tears. Once this is over with, you are going to make sure that they are comfortable and assist them into their new gown. Hey, sit. No, sit. With dressing a patient, you always start on their weaker side. So we are going to start with his sit. We're going to start with his weak side, and for Mr. River, this is his arm. You can reach into the shirt like this, through the arm, and then through the bottom, and that will help you guide their arm through. Then you can put in the head. Good boy. And then you follow through with their strong arm. After that, they are good to go. We have a bathed client. Thank you, Mr. Rivers. Good boy.